Hey Lee, Tell here. Just thought I'd do a little reply to your message on British citizens about saving the NHS and opposing the government health bill. Now, I know I'm running a little bit late on this because they've already had the Lord's vote, and despite the best efforts of people like yourself and myself signing that petition, the Lords decided to pass the bill with very clear margin. Now, as I've made a point before, I've worked in the NHS, still do, and it's probably one of the better healthcare systems in the world. Don't let people tell you otherwise. It's free at the point of entry and remains at very little cost. I think it's around £7.40 per item on a prescription, which is about $15 in the US, roundabout. And I think that's excellent value for money. Now, it's not free completely. Those who can afford to pay tax pay national insurance contributions towards the general level of healthcare within this country. But I think the problem in general with the NHS is the lack of transparency and the general feeling that there's a massive amount of waste and bureaucracy within the NHS. Also, some of the decisions that have been brought up by people are generally seen as ridiculous. For example, the NHS in our area, and in fact the hospital that I work for, recently issued a story asking people if they wouldn't mind giving up their annual leave as part of cost-cutting exercises because they're so in debt that they can't afford necessarily to pay everyone's annual leave and not get rid of their deficit. They're running at several million in deficit, and they think that by cancelling everyone's annual leave, they're going to somehow get rid of this problem. But I really don't think that's the case, and I really think they don't think it's the case either. The truth is, within a lot of these organisations, there is waste. You can't deny that there's waste, that there's spending that's not being allocated correctly. And of course, I would want to save the NHS, much like yourself, Lee. I don't want to see it go. I think it's one of the best healthcare systems on the planet. But I do think that in some ways, the Conservatives would have a point that there's waste and bureaucracy. There is a shocking amount of bureaucracy. There are coordinators for this, managers for this, service managers for that. There's a lot of doubling up that could be got rid of. But this is the point, and this is the reason a lot of people object, is because it's in the wrong places that the cuts are being made. The cuts are only really being felt by the lower levels. I mean, I myself had a pay cut. I was told that my job had been reclassified and I would be put on a lower band scale. Now, I didn't see that as fair, but, this is what they do. So, I don't know. I feel like you would need a broom to completely sweep clean the entire way of working within the NHS, because it can be at times very nepotistic. It can be about who you know, not just what you know and how much you're paid. But I would join you on this, Lee. I think we need to tell the government that the NHS is one of the most important organisations in this country. And no matter how much people decry it and they slag it off and they go, I had to wait here for so-and-so amount of hours, I agree with you. I don't think people would necessarily want, they would want to endure an American-style healthcare system where if you don't have coverage, you're not going to get the best level of care. You do get some care, though, Lee. I do have to kind of pull you up a little bit on that because, well, as you know, my girlfriend, she's from the great state of Louisiana, and she was explaining this to me at one point, that there are such things as charity hospitals in the United States where you can get a good level of healthcare, and you do still have to pay, but they work out some level of payment plan. Now, I don't know if that's exclusive to Louisiana, or maybe there are other places that do this, but she said to me that you're not going to be entirely left out. There are places people who are less well off can go, and they will get help. But like you say, it's not necessarily free at the point of entry either, so it's not an ideal system. But yeah, anyway, sermon over. Just wanted to say, nice work, Lee. It's a shame that the vote didn't go the way we wanted it to, but keep on 'em, mate. This is El Presidente Tel. Love, peace, liberty.